Okay, so we're going to begin talking about hearing loss and your patient. So odds are you're going to be working with many people that have hearing loss, and hearing loss is known as an invisible condition, so it's not an obvious thing that a person's walking around with a hearing loss, but it's something that you should be aware of because it's going to affect their adherence to your medication directions. So the goal of this PowerPoint is to help you gain an understanding of the auditory system, to understand the physical and the physiological repercussions of a hearing loss, and to learn methods to improve your communication with persons that have hearing loss. So hearing loss increases with age, and as of right now, there are nearly 13 million people in the U.S. over the age of 65 with hearing loss, and this is going to have a substantial impact on their speech and language, both receptive and expressive. So I'm going to begin by talking about a little bit about the ear and how the ear works. Your ear is divided into three parts: the outer ear, the middle ear, and the inner ear. And they each serve their own function, and together they help us hear very soft sounds to very loud sounds rather seamlessly. So the first part of your ear is the outer ear. That's your pinna. It collects sound waves and it transfers the sound waves through to your ear canal. It terminates at the eardrum. This is the marker between your outer ear and your middle ear. So you have your ear canal here, and then your tympanic membrane, or your eardrum. Your eardrum is the first mobile link in a chain of auditory events that transfer sound to the middle ear. So your middle ear is an air-filled space with the three tiniest bones in your body. It amplifies sounds before they're sent into the fluid-filled cochlea. So without our middle ears, it would be like we were swimming underwater. So we have sounds traveling from air to fluid in the cochlea, and the middleman is that middle ear, which amplifies sounds so that we can hear them in the cochlea. Now your middle ear is aerated by your Eustachian tube, which is connected to your nasopharynx. And that's why you see an ear, nose, and throat doctor, because your ear, your nose, and your throat are all connected. So over here we have the Eustachian tube of an adult on a vertical angle, and the Eustachian tube of an infant is on a more horizontal angle. So you have your outer ear, which collects sounds and funnels it to the middle ear, an air-filled space which amplifies the sound before the sound is sent to the cochlea. And the middle ear is supposed to be filled with air, and that's why we have our Eustachian tube, which connects to our nasopharynx. When you go up on an airplane or very high up in an elevator, you might feel like your ears feel full. Your ears are full with air, but what makes them feel uncomfortable or different is the fact that there's pressure difference between way up high in an airplane and at sea level. And when you chew and when you yawn and you chew your gum and you swallow, you're opening your Eustachian tube, you're aerating your middle ear, you're balancing out the pressures, and you're able to hear better. So beyond your middle ear is your inner ear, and that's your cochlea, the snail-like shell, which is your hearing organ. And then you have these semicircular canals, which are your vestibular system. Your vestibular system is important for balance and equilibrium. So your cochlea is your hearing organ. It's this snail-like shell that's filled with these hair cells. They're not really hair cells, but they're projections that help process sound, and they convert waves into messages that travel to the brain via the auditory nerve. Your auditory nerve, you have these series of way stations where sounds are processed and shared and processed and shared all the way up to your auditory cortex. And here's a quick video on the auditory system. Okay, so let's go back to our PowerPoint. Now, aside from the anatomy and physiology, there are different types of hearing loss, and the types of hearing loss depend on where in the ear the problem is. Humans can hear frequencies ranging from very, very low-pitched sounds to very, very high-pitched sounds, and the sounds that are most important for speech are between 250 and 8,000 hertz. Now, frequencies below 500 hertz are considered low pitch, and those are the sounds such as vowels and environmental sounds. Low frequency sounds carry the melody of our speech. Sounds 1500 hertz and above are considered high frequency, and they're very important for speech. They carry the energy and the consonants, and they give us the meaning of the speech. So this is an audiogram. This is a figure that we use to measure hearing loss. These are some common sounds: a faucet dripping, leaves, people whispering. Here are the phonemes of our language. We have very, very high frequency sounds like F, S, and TH, and we have sounds that are lower frequency with more energy. Normal hearing people hear at 20 decibels and better. So if you have normal hearing, you're hearing all of these sounds. As you have a hearing losses tend to get worse over time, and you would lose the ability to hear sounds like P, H, G, K, T, but you might hear other sounds. So you would understand that speech is happening, but you might not get the meaning of it. Okay, so you can see as the Flintstones' hearing got worse and worse, it was harder and harder to hear their conversation. So it started at normal hearing, and then they had a mild hearing loss where they missed some of these sounds, down to a moderate hearing loss where they missed more sounds, towards a severe hearing loss where it was very hard to follow the conversation. There are two main types of hearing loss that we're going to talk about. Like I said, they have to do with where the loss occurs. So conductive hearing loss is a loss that occurs in your ear canal or your middle ear space, and a sensorineural hearing loss occurs in your cochlea or your auditory nerve. The sensorineural hearing loss is very, very common, especially as people age, and that's the type of hearing loss you're going to come across most often. So a conductive hearing loss is a loss due to a decrease in the strength of a sound whenever there's a barrier present in the outer or middle ear. For example, if you have a blockage in your ear canal or fluid from an ear infection, that will create a conductive hearing loss. So otitis media, I'm sure many of you had otitis media. It is an ear infection, an infection of the middle ear space. So you see, here's your middle ear. With otitis media, this air-filled middle ear space is filled with fluid, and the fluid gets in the way of sound being conducted through the pinna, the middle ear, and then into the cochlea. And it's caused by poorly functioning Eustachian tubes. So if you remember in that previous picture, I showed that adults have vertical Eustachian tubes, which help drain the ear, and children with their very cute and round faces have more horizontal Eustachian tubes. Therefore, when a child gets a cold, it's much more likely that the child will blow that cold into their middle ear space. Now, with sensorineural hearing loss, this is a disorder of hearing produced by an abnormality or a disease in the cochlea, and it accounts for the largest group of hearing loss. People that have sensorineural hearing loss could have areas of normal hearing and areas of profound hearing loss. It depends on where the damage occurs in the cochlea. So, people that have this type of hearing loss, they often complain that they have trouble understanding speech because they have some areas of the cochlea, for example, low frequency sounds, that are okay, and some areas of the cochlea that are damaged, like the high frequency sounds. Here's two pictures. We have what normal outer hair cells should look like on the left, and what damaged outer hair cells look like on the right. And once your outer hair cells are damaged, they do not grow back, they do not repair themselves, and there's nothing we can do to treat this sort of hearing loss at this time. So there's a reason to protect your hearing, because you certainly don't want your cochlea to have hair cells like this on the right. Causes of hearing loss include aging, genetics, noise exposure, trauma, viral infections, and ototoxic agents. There are toxic causes of hearing loss. There are ototoxic medications that are cochlear toxic that might cause mild to severe hearing losses. These hearing losses tend to occur in the higher frequencies, and it's important to monitor patients that take this medicine and counsel them when there are no other alternatives. There's also nicotine and alcohol. Large amounts of this over extended periods of time could cause hearing loss. Here are some other ototoxic medications that I'm sure you're familiar with. You can use this as a reference when you go forward with your careers. And some other ototoxic medications. And remember, the more than one medication with an ototoxic potential is administered, the effects can become additive. Now, hearing loss could have different onsets. Prelingual would be before the acquisition of spoken language skills. Perilingual is while the child is learning speech and language. And postlingual would occur after the child has spoken language. Hearing loss can be progressive or it could be sudden. Progressive occurs over the course of several months and years. It's often due to aging. This is this age-related hearing loss that I keep bringing up, presbycusis, and usually it occurs over 7 years. It takes a person about 7 years to seek treatment for this type of hearing loss. There's also sudden hearing loss caused by head traumas or ototoxic medications, but that is less common. Hearing loss can be mild, moderate to severe, severe to profound. Those people would be considered hard of hearing. But then there's also people who are deaf with hearing losses greater than 70 decibels. There are some listening devices that we could use. Listening devices are instruments to minimize the conversational difficulties and maximize the use of residual hearing. So residual hearing is the hearing that is not gone, the hearing that the person still has. Some listening devices are hearing aids, cochlear implants, and assisted listening devices. And the objective of these listening devices is to make speech audible without introducing distortion or discrimination, and to restore the range of loudness. So hearing aids, the goal is to maximize the access to the speech signal at a listening level that is safe and comfortable. So what hearing aids do is they amplify sounds. That's all they really do at the end of the day. They're programmable. We can have directional microphones. It's better to use 2 than 1. And there's going to be an adjustment period because they take a while to get used to. But at the end of the day, hearing aids are not like glasses. It's not like you're going to put a hearing aid on and you're going to hear like you did when you were 10 years old. The problem is that when people get cochlear hearing loss, that age-related hearing loss that also is associated with noise exposure, their cochlea is damaged. So the cells that process sound are damaged. So a person may be wearing a hearing aid, but the hearing aid is simply amplifying sound. If the cochlea has no cells available to process it, then there's not too much that can be done. So even though your patient might be wearing a hearing aid, understand that they're still not hearing as well as they once did. There are also cochlear implants. Cochlear implants bypass the damaged or missing hair cells in the cochlea, and they directly stimulate the auditory nerve. So this gets around the problem of the cochlea being damaged by directly stimulating the auditory nerve, but again, it's a different sound than what the person is used to. It's, a processed speech, It's not a quick fix. Not everybody is successful with cochlear implants, and there is a big adjustment period. In order to be qualified for a cochlear implant, a patient has to have an irreversible, severe to profound, bilateral, that means 2 ears, cochlear hearing loss, and in good general health. Cochlear implants are wonderful for young children and infants because their brains are very plastic, but they don't work as well in adults. Adults that are grown, that's brains whose brains are already, set. All the connections are made. Here's a quick picture of a cochlear implant. There are external portions and then there are internal portions. So there's a receiver up here that picks up sounds and processes it. It sends by waves across the scalp into the internal receiver, and then you have an electrode array inserted in the cochlea that directly stimulates the auditory nerve. Now, there are assisted listening devices which can be used in addition to or in lieu of hearing aids and cochlear implants. Assisted listening devices are more affordable than cochlear implants and hearing aids. They can be used in specific situations. They're good for patients with arthritis and limited dexterity because if you think about it, hearing aids can be very tiny. So if a person has any sort of dexterity issues, using hearing aids might be a challenge. An example of an assisted listening device that you may come across include FM systems and the pocket talker. So a pocket talker amplifies sounds closest to the listener while reducing background noise. Pocket talkers can be used in one-on-one conversations, indoor and outdoor, restaurant small groups with the television or the radio. They are affordable and easy to use. There are also FM systems, which are a bit more expensive. A microphone is worn by the speaker, and the voice of the speaker is amplified directly to the listener's ears by a receiver or through the hearing aids. This helps improve the signal-to-noise ratio. The distance between the speaker and the listener is no longer an issue, so these are sometimes used in classrooms. For example, a teacher will wear her FM system, and the child with hearing loss can sit in the back of the room, and no matter where the child is in the classroom, he or she will always be hearing the teacher's voice. So this is a very common type of assisted listening device. It improves the signal-to-noise ratio and makes the person's voice louder than the noise and helps improve understanding. Here are some pictures of FM systems or call caption telephone. Texting is really great for people with hearing loss, provided they don't have any visual issues. And then you can get TV ears so that your spouse isn't annoyed by the volume of the TV. There are some things that we need to talk about with the patient and age-related hearing loss. So far we've spoken about the anatomy and physiology of the ear. I gave you a quick overview of that. We spoke about the types of hearing loss and the degree of hearing loss and some hearing aids, cochlear implants, assisted listening devices. And now we're going to talk about the patient and their hearing loss. So this age-related hearing loss, this cochlear hearing loss that I keep going back to, is also known as, or more formally known as, presbycusis. And it's affecting an increased percentage of our population because we're living longer, and often people have no other health issues aside from their hearing loss. We're living longer and we're living in a noisier place. So hearing loss, with this type of hearing loss, they tend to have worse hearing in the high frequencies than in the low frequencies, and they may perceive conversational speech as too soft or mumbled. But remember, they're not hearing all of the sounds of speech, and that's why they think it's too soft or mumbled. And the number one complaint that these patients will have is, I can hear you, but I can't understand you. So they recognize that speech is happening, but they're missing out on a lot of the consonant informations, so they're having trouble determining what is being said. Now, some people with mild hearing losses are certainly going to do better than those with severe hearing losses. A person that is a good speech reader, so a person that's able to read lips and read your face and your expressions, is going to do better than someone that is not. And how well an individual concentrates on a message is going to influence its perception. So if a person is stressed, if they're anxious, if they're fatigued, they're going to have a hard time following your message. I use the example, think about your most challenging class that you sit in. Now, is it sometimes hard to sit in that very hard class with that challenging material and focus on it the whole time? Well, maybe you get tired of listening, or maybe you get anxious that you're not following the material, or you get stressed. And the more stressed, the more anxious, the more tired you get, the harder it is to follow the message. Now, imagine being in that class and having a hearing loss, right? So it could be very stressful to have a hearing loss and very tiring to have a hearing loss. The person with hearing loss may bluff and pretend to understand what you're saying in the spirit of cooperation, to just, because it's easier to bluff and to say, yes, I understand, than to, keep asking, can you repeat yourself? I'm sorry, I didn't hear that. So sometimes the patient with hearing loss might just bluff and pretend that they understand. Or they might withdraw socially and avoid communication difficulties. So they might say, oh, it's not even worth it. I'm just going to stay home. It's too much effort to go outside and to try to speak with people. Or someone with hearing loss might dominate the conversation. That way they always know what's being talked about. A person with hearing loss might succumb to feelings of anger, hostility, or self-pity that they weren't or they aren't what they used to be. A sign that they're getting older. Hearing loss is an invisible condition. I said this early on. Nobody knows you have a hearing loss. So if I were sitting on the subway and a man with crutches was standing, I would get up and give my seat to the man with crutches because I would see that he had knee surgery. But a person with hearing loss, I don't know that they have a hearing loss. So I don't know to speak to them clearly and with concise messages and to face them and to minimize background noise, because hearing loss is an invisible condition and its consequences can be manifested in a broad spectrum of a person's life. It'll affect their relationships at home, their ability to do their job, and their life in the community. So there are psychosocial consequences of hearing loss. Older people with hearing loss might demonstrate anger, frustration, antipathy, and fear. And their communication partners might get impatient, annoyed, frustrated, and feel sympathetic towards their partner. And there are all sorts of negative reactions that could happen. So, emotional distress about the hearing loss leads to withdrawal. They don't even bother. And then if they isolate themselves, then they feel bad about themselves. So, it's this bad cycle. So emotional distress, withdrawal, social isolation, depression, that doesn't help anybody's well-being. So we're just going to watch a video of a mother and daughter speaking about their hearing loss. Okay, so it can be very hard to have a hearing loss, and it affects not just the person with the hearing loss, but also their family. So what happens when you have a conversation with the person that has a hearing loss? Well, interruptions are going to occur more frequently. There are going to be more questions for clarification or misperceived messages. There's going to be a greater effort to ensure that all people with hearing loss have the opportunity to contribute to the topic's development. And the person with hearing loss might contribute remarks that are not relevant to the conversation. There could be disrupted taking of turns. The person with hearing loss might not hear that intonation contour at the end of the sentence that tends to be high frequencies. Therefore, you could have inappropriate silences. The person with hearing loss doesn't recognize it's their turn. There could be inappropriate topic shifts, where the person with hearing loss doesn't recognize the previous remarks and may inadvertently or inappropriately change the subject. And there could be superficial content. Because speech recognition is difficult for the person with hearing loss, they might avoid certain topics and talk only about topics that they're familiar with. There could be frequent clarifications. So the person with hearing loss might say, "I'm sorry, I didn't understand that." And this could interrupt your conversation. So there are some methods that you could do to help improve the flow and the understanding of your conversation with this person. The first thing you could do is make sure your environment is as quiet as possible. So get rid of the background noise if you can. And the environment should be well lit. So the person with hearing loss should be able to see your face well, because your face is going to give away a lot of the message. You want to stand with a good distance from the communication partner, no visual distractions, and a good viewing angle. So a quiet, well-lit background where the patient can clearly see you. You need to speak clearly and slowly with your face towards the hard of hearing individual. Don't put stuff in your mouth. Don't chew gum. Stand away from windows or bright light sources that might shine in the person's eyes. You just need to give them a clear viewing angle. You should show empathy. It is very challenging to have a hearing loss. There's a lot of stress and anxiety associated with the hearing loss. And there's fatigue and social withdrawal.
One thing, but I want to understand what having noise-related hearing loss is actually like. By filtering out the high frequencies, this setup mimics the hearing damage caused by loud noises. So here's my chance to experience the world through damaged ears. Don't understand the problem? Well, this is how I heard it. This is what the world sounds like to me now. When I'm really concentrating, my brain does its best to fill in the gaps. But the minute my focus drifts, almost nothing makes sense. Things that I would normally feel comfortable doing become pretty tough. I just didn't catch what he said. Confusion reigns.
Okay. So it's hard to have a hearing loss. What I do sometimes is to protect my ears, I'll wear ear protection that I get at a drugstore, and I'll keep them in my ears and I'll go about my day, and it helps me concentrate, but it also helps me build empathy for how difficult it is to have a hearing loss. So even with those foam tips, you create like a mild to moderate hearing loss, and if you ever wear them out in public, you see, it can be very hard to have a hearing loss, and you need to focus and you need to pay attention and you need to watch a person's mouth, and it does create stress and it does create anxiety, and lip reading is not easy. So there's some things that you could do to help the person with hearing loss better understand your message. You want to avoid verbosity. Use concise and syntactically simple sentences. Try to avoid ambiguity. Use precise terminology. So this message, geez, you should have seen the game Friday. It would have blown you. I can't even say it that quickly, but imagine how that is for someone that has hearing impairment. So it's spoken way too quickly, blurred together word boundaries, and you're omitting some of the word's components. So when you speak it a bit slower, it's better. So, geez, you should have seen the game Friday. It would have blown you away. But this sentence can be made even better. So, I saw the baseball game Friday. The game was great. So why is the second sentence so much better? I saw the baseball game Friday. The game was great. This message has simpler syntax. You repeating the keyword game twice, 2 simple sentences instead of 1 long sentence, no ambiguous references, and no colloquialisms. You could also ask your patient, did you understand? Did you understand my directions? And then provide feedback whether or not they did correctly understand your message. So when you're speaking to someone that has a hearing loss, remember, set the environment, a well-lit, quiet environment where the patient can see you clearly. Use appropriate speaking habits, so simple sentences, a good, clear voice, don't chew gum, make sure the patient has a clear view of your face, display empathy, it's very hard to have a hearing loss, and ask the patient, do they understand? So to review, a large percentage of our population suffers from hearing loss, which is an invisible condition. Cochlear hearing loss is irreversible. Due to the nature of cochlear hearing loss, your patient may not recognize that speech is occurring. They might have trouble understanding the whole message. Assisted listening devices such as a pocket talker can be used to help improve understanding, control your environment, use appropriate speaking behaviors, modify your message, and display empathy. Here are some references and more links about hearing if you're interested. Thank you.